Hey everybody, I'm Dr. Busybody. I'm a board-certified doctor for adults and kids, and I'm here to bring you info and insight into common medical questions. Real quick, I'm not here to give you medical advice. For that, you're going to have to speak with your primary care doctor. This brings us to today's topic, primary care physicians, or PCP. Just so you know, it's not the drug we're talking about here. Anyway, so PCP. Who are they? What do they do? And why do I need one? Let's answer all these questions. A PCP is a doctor you see for yearly checkups, for random doctor visits when your ear hurts, and the doctor you see for preventative care. Don't worry, we're going to talk about all these in more detail. Let's start with yearly checkups. So during these visits, your conversation might go something like this, where the doctor asks how you're feeling, and you get to tell them exactly what you're worried about. The doctor will take notes and tell you exactly what to do for next steps. While you're there, you might feel like you're being put under a microscope, but this is super important so that the doc knows every detail of your ailment and can diagnose you appropriately. The doctor might ask you to get some lab work, get some vaccines, and do other testing like colonoscopies or mammograms or pap smears so that we can catch diseases early or prevent them from happening altogether. So why is it important to have all this medical care in one place? This can be explained by a weird doctory term called continuity. Basically, the PCP will see you year after year and get to know you really, really well. This makes doctor visits more efficient because they already know you. This is an incredible asset for everybody to have. I highly recommend. Now, what kind of doctors become primary care doctors? Well, there's internal medicine doctors, family medicine, there's also pediatricians for kids, and adolescent medicine for teenagers. Keep these types of doctors in mind when you're looking for a primary care doctor. Now, how do you do that? Well, the first option is to call individual clinics and ask them whether they accept your insurance. But speaking from personal experience, the clinics themselves are not 100% sure all the time. So let's move on to the second option. You can turn to your insurance provider and call them for assistance. They, of course, should have an entire database of clinics that they service. The third option, I think, is the best. Visit ZocDoc.com. The link is in the description box below. This is a super convenient website that helps you choose a specialist, PCP included, in your area and that is covered by your insurance. Once you select those options, there's even an option to make an appointment through the website. It's a super helpful site. Try it out for yourself. The next option would be to do a random Google search, but probably the least efficient of all the options. One more thing to remember. If you need a subspecialist like a surgeon, dermatologist, nephrologist, etc., some insurances require that you need a referral from your PCP. Make sure you know what your insurance will accept. This is all the more reason to have a PCP so that you can easily call them up and get a subspecialty referral arranged without delay. Okay, slight change in topic, but I think it's really important. Have you ever questioned whether you need to go to the PCP or ER or urgent care? Well, let's talk about this in detail. So go to the PCP office when you have mild symptoms like an earache, a cough, a rash, and also for the things I already mentioned, like for preventative care or to manage long-term medical problems. Now, an ER or urgent care are a whole other ballgame. They should be used for severe symptoms like chest pain, abdominal pain, etc., as well as for accidents and fractures. If we base the decision to go to the PCP versus ER solely on symptoms, it's a very difficult question to answer because pain is very subjective. But trust me, if you end up going to the wrong place, you will be redirected to the appropriate level of care. When in doubt, call the nurse line at any primary care clinic. There is usually an option to talk to a medical provider when you call the main number for a clinic. The nurse on call can help direct you to the best place to get your medical care. Okay, in summary, just get a PCP. It makes medical care so much easier. As always, see in the description box below for references. Please comment if you have any burning medical questions and I will try to answer them in upcoming videos. Also, like, share, and subscribe so that you don't miss future videos. Have a wonderful and healthy day. Thank you.